Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Regenstrief Institute research scientist April Savoy, Ph.D., a human factors engineer and health services researcher, is developing and testing user-friendly health information tools and technology designed to enhance accessibility and value to older adults with both diabetes and Alzheimer's disease. Without numerous fingersticks, these tools and technology will be designed to provide patients, caregivers, and clinicians with glucose metrics needed to diagnose hypoglycemia and identify treatment options. Older adults with Alzheimer's and type 1 or type 2 diabetes have a high risk of low blood sugar, known as hypoglycemia, which is often undetected. Hypoglycemia can cause dizziness, confusion, mood changes, hospitalization, and even death. Diagnosis and treatment of hypoglycemia can prevent complications. Alzheimer's disease is a progressive disease, and hypoglycemic events can accelerate cognitive decline. That's why we are focusing on detection of low blood sugar in these older adults with both Alzheimer's and diabetes, said Dr. Savoy, assistant professor in the Purdue School of Engineering and Technology at IUPUI. Repeated fingersticks to test blood sugar levels, following a prescribed diet and exercising can be difficult for patients with Alzheimer's. Use of traditional blood sugar monitors may be problematic for individuals with Alzheimer's as well as caregivers. The study, Enhancing Shared Decision-Making to Prompt and Guide Individualized Care for People with Alzheimer's Disease and Diabetes, will enroll 75 pairs of older adults with both Alzheimer's and diabetes, and their family caregivers. But this new research, implementing a human factors engineering approach, targets older adults who have already been diagnosed with both Alzheimer's and diabetes. Dr. Savoy and colleagues will investigate unique population dynamics, including how much data about glucose levels are needed, how to acquire them, and what works to enable shared decision-making for all involved, patients, caregivers, and clinicians. We hope to increase awareness and empower patients and caregivers to make individualized, patient-focused decisions about effective treatment options. Our goal is to prevent hypoglycemia for the growing population of older adults with Alzheimer's disease and diabetes, said Dr. Savoy. Collaborating with Dr. Savoy on this work, which is supported by a new 5-year grant from the National Institutes of Health's National Institute on Aging, are Regenstrief Institute investigators and Indiana University School of Medicine faculty members Michael Weiner, MD, MPH, who has conduct. Dr. Savoy and colleagues recently authored a commentary in the peer-reviewed Journal of Diabetes Science and Technology, on the importance of applying the human-centered design process to continuous glucose monitoring and investigating design solutions and interventions to integrate continuous glucose. Authors of Improving Care for People Living with Dementia and Diabetes, Applying the Human-Centered Design Process to Continuous Glucose Monitoring, in addition to Dr. Savoy and the collaborators on the new grant, noted above, are Daniel O. Clark, Ph.D., of Regenstrief Institute and Indiana Univer. This research was supported by the National Institute on Aging of the National Institutes of Health under Award Number K01 AG 076971-01. April Savoy, Richard J. Holden, Mary de Groot, Daniel O. Clark, Greg A. Sachs, David Klonoff, Michael Weiner. Improving Care for People Living with Dementia and Diabetes, Applying the Human-Centered Design Process to Continuous Glucose Monitoring. Journal of Diabetes Science and Technology, 2022, 193,229,682,211,379 doi, 10. 11,177,19 Regenstrief Institute. Redesigning diabetes technology to detect low blood sugar in older adults with diabetes and Alzheimer's disease. Science Daily, the 6th of December 2022. ift.tt/5n6zsk. https://ift.tt/5n6zsk. Access December 6, 2022. Thanks for watching. Please subscribe my channel for more videos.